It's mid-morning. Theatre staff prepare for their second operation of the day. Trays and trays of the equipment needed are laid out. Each instrument is checked and counted.
So we'll set up a standard supine, 1 foot support, side support. And a
Most of the patients needing a hip or knee replacement have osteoarthritis. And the surgery at this private hospital is focused on getting them home as quickly as possible to help them recover. In some cases, on the same day.
Definitely busier than we'd forecast and we'd planned in the initial planning stages of opening the hospital. We've seen large demand across all the specialities that we've been offering, particularly in orthopaedics. We've done over 150 orthopaedic cases since March.
The day case model has been really exciting because it's this enhanced recovery that gets people out the door and home, and you recover better at home, so it's been exciting to see that happen.
We're seeing anyone from the early 50s right up until their mid-80s coming to this hospital. But it can affect people throughout their whole adult life, depending on the reason for their arthritis.
Ilanic, which began 13 years ago offering cosmetic surgery, opened the doors of its Glasgow hospital in the spring. This hospital in the city centre was once a bank. Now, within its vaults and former office space, 3 operating theatres and a 5-bed ward.
Every day is very different, cosmetics, general surgery, everything. We're definitely a jack of all trades here. Where I worked in the NHS before, it was all emergency, so you couldn't be super organised. Whereas here, because it's all pre-booked, pre-planned, you can be as organised as you want, mentally prepared, ready to get it done. Working really closely with the surgeons and making sure we're giving out the right information is always key.
The operation is the smallest part of the path. Actually getting them ready for surgery is a really big thing. So making sure somebody is as optimised as possible, and what I mean by that is staying as active as they can right up until they have the operation to maintain their muscle function, to keep their range of movement as much as it can, and just their exercise tolerance, so they are as fit as they physically can be for an operation.
Come on in.
At the age of 72, John Mackay from Cumbernauld has no intentions of slowing down. He's not currently on any NHS waiting list, but he has been told his arthritis is fairly advanced. At his pre-op assessment, John explained his reasons for opting for a full knee replacement.
Just had more and more pain with it, coming up and down stairs, walking, it's been more difficult. And I play a lot of tennis, so I've had to give up playing singles tennis because there's too much court to cover. But I still play doubles because there's not a lot of running about. But that's my main focus, is to keep playing. Last October started the process, and I've been to an NHS physiotherapist. But I know that the waiting list is in the region of 2-3 years at best, and I'm not getting younger.
Hello. Hi, Mr. Mackay. How are you doing?
I'm good.
Good.
A few weeks later, John is ready for the first of 2 full knee replacements.
Can I put a wee arrow on your leg? Yeah. This one. We're planning for a right total knee joint replacement. You and I have spoken about the benefits of that operation for you, and ultimately the benefit is pain relief and long-term pain relief. That is the outcome we're looking for.
Initially awake when he was taken into theatre, a chat with the medical team helps to calm the nerves as sedation is increased.
This might feel a little bit strange because we're going to start moving your leg around, and you won't have that feeling, so it'll feel a bit odd. But can you push his leg out? So I say, yeah, brilliant.
Thank you. Downstairs waiting in outpatients is Maureen Higgins, exactly 2 weeks on from her knee replacement.
I was absolutely terrified of the operation, and the nurses upstairs were laughing because I even shut my eyes. I don't know what the inside of the operating theatre looks like because I had my eyes shut all the time.
To be considered for surgery either in Scotland or abroad, the 66-year-old was told she had to lose a considerable amount of weight.
5.5 stone. When I reached the target, I had decided that I was going to go to Lithuania to get it done because the waiting list in the NHS, was really, really bad. It was an 88-week for a consultation with a knee surgeon, then 4 years.
Maureen instead opted for private treatment in Glasgow. She postponed her retirement for months to save up the money to pay for her knee replacement.
Just being able to walk without that excruciating pain. I just feel like a new person. I've now got a new wee baby granddaughter. You know, I want to be able to take her out, push her in the pram. I couldn't even hold her. She's a year now, and I haven't been able to hold her until I got this operation. But every day, you know, has been a bonus.
Right leg, mark.
From scalpels to hefty power drills, the tools of this trade are extensive.
So the first thing that we do is we confirm that they've got arthritis. He's had x-rays and we know that, but now that we're in the knee we can see he's got full thickness cartilage loss on the inner aspect.
While there have been advances in robotics, this method of replacing hips and knees is the most common carried out both in the private sector and in the NHS. As the surgery progresses, measurements are taken.
Can I take the 5 first?
Different sizes of implants are tested.
To get really good full range of movement, that everything's gliding nicely and that we've got no over tightness or looseness in any particular position.
There's a misconception around private healthcare is only for the super wealthy or sports professionals. There's a demand out there for trying to get people better sooner so could get back to work. We've gone from less than 20 members of staff to over 70, so we're employing nurses, we've taken on consultants. The next stage will be diagnostics. We're looking at investing and doing a joint venture with an MRI scanner. We think this model is the way forward.
On Bath Street, this hospital sits alongside a cluster of independent healthcare providers. They range from private GPs, cosmetic surgery clinics, mental health services and dentists. Within this sector, an uptake in medical insurance is another emerging trend.
Because of the problems of delay in the National Health Service, this is a natural market-based response. This is the private sector seizing its opportunity to build on the latent demand that is out there. There are further dangers as well, in that we could observe a whole generation of younger people who look at this situation as the norm. That then leads them to think, oh, we should take out private insurance to cover me in the future, based on what I see as an illusion, which again is that of helping the NHS.
So that's the 7 with the 5. Part of the arthritic process is the bone becomes harder. We say that it becomes sclerotic, so it becomes really, really dense. And even our power saws were struggling to cut it.
The NHS is amazing at what it does. We're only a small fraction of offering a slight option for those that we're relevant for. We're here to support with either demand, and if we can be taking some small pressures off the NHS demand, that hopefully should allow quicker access for the people who really need to see the NHS in real time.
Can I take the PCL retractor? Lovely, and then I'll just check there's none around this lateral side.
So just under an hour after the first incision, the knee replacement surgery is complete and John is ready for recovery. And can you remember much about operation or?
Out like a light. I was in a beautiful dream somewhere, but I don't know where it was.
A week before surgery, each patient is enrolled in joint school. That relationship with a physiotherapist is then crucial when they wake up after their operation.
All right, so whenever you're ready. Good, put weight on that right side.
4 hours later, we get you walking. You know, that's imperative for your recovery. So you'll be walking with aids, whether it be crutches or a Zimmer frame or any of the other kind of aid that we kind of use. But you will be walking on day 1 of your surgery, which is a fantastic thing. That's an accelerated programme. And then we just do like a phased recovery with that as well.
I'm going to release a bit. I just want us to stand nice and tall. Good. Nice. That's looking good.
I was amazed when I came off the bed there that I could get so much bend in it. I'm sort of stunned about that. So I'm really optimistic.
Right. So take a wee pause there.
To get home, the patient must pass the stairs test. Completed by John around 20 hours after his surgery.
Right, stick. Good one. Perfect.
I would usually expect somebody to be walking without an aid probably within 6 weeks, okay? Possibly back driving 6 to 8 weeks.
I can't believe it. Yeah, it's incredible. Colin said my kneecap was like granite. Did he tell you that?
We saw it.
It's amazing. Just the whole process is hard to believe. I just can't wait to do the other one.